It was a monumental day for the Philippines back on June 21st, 2018 because for the first time in the country's history, the first Mental Health Act legislation was officially signed into law and enacted as the Republic Act number 11036, which provides individuals with mental health disorders these services while protecting their rights in the process. It also aims to strengthen the study regarding the topic so that future mental health professionals would not just be better equipped, but more informed as well. It goes without saying that the act has been long overdue. The issue of mental health in the Philippines continuously proves itself to be very much prevalent, as is evident with the number of Filipinos suffering from it annually. In a study done by Tagubtob in 2016 about the mental health status in the country, he reported that 1 in 5 Filipinos suffers from a mental health problem. This number accounts for both adults and children, with 17 to 20% of Filipino adults experiencing psychiatric disorders, while 10 to 15% of Filipino children ages 5 to 15 suffer from mental health problems. Some of the most common mental health disorders according to the new Philippine Health Information System on Mental Health are depression, anxiety disorder, schizoaffective disorder, acute and transient disorder, and stimulant-related disorder, with schizophrenia being the top mental health problem in the Philippines. Mental health illnesses are the third most common morbidity for Filipinos. A national consensus they conducted also showed that 14% of all disabilities, estimated at around 1.4 million people, are mental disabilities. Unfortunately, many challenges plague the mental health sector in the Philippines, which prevents them from providing proper help for those who need it. First of these challenges is the small number of mental health professionals readily available for patients. The World Health Organization recommended that every country should have at least 10 psychiatrists per 100,000 of the population. Compared to that, the Philippines only has 2 to 3 mental health workers per 100,000 and 1 doctor per 80,000 Filipinos. Financial constraints have also contributed to many of the ongoing issues within the sector. There are only 2 tertiary care psychiatric hospitals within the Philippines, both of which are located in Luzon: the National Center for Mental Health in Mandaluyong City and the Mariveles Mental Hospital in Bataan. Because of the location, many Filipinos living outside of those cities who require help could not access them. In addition to this, even though there are 12 other hospitals affiliated with the National Center for Mental Health spread out around the country, most of them are overcrowded, filled with poorly functioning units, and short on staff. While the passing of this law does not automatically fix these issues, it is a big step for the country towards becoming an accommodating environment for mental health patients. Aside from the obvious lack of proper mental health services here in the Philippines, perceived or internalized stigma has also prevented many from seeking mental help. With the passing of the Mental Health Act, the topic is further legitimized as an active issue among Filipinos and validates their feelings towards it. Hopefully, with time and continued support to the mental health sector, approaching mental health professionals would be an easy and common occurrence for all Filipinos.